This segment is sponsored by Dominion Behavioral Healthcare.
We're in store for an incredible conversation today. We are joined by Dr. Ashvin Patel. He's a board-certified adult and geriatric psychiatrist, and Dr. Michelle Sullivan. She's a licensed clinical psychologist with Dominion Behavioral Healthcare. It's wonderful to have both of you with us.
Thank you.
Our pleasure. 2020 has certainly driven the demand for mental health services. Dominion Behavioral Healthcare is seeing that there are some innovative technologies and treatments now available, which is encouraging news. We're going to talk a little bit about that today. But Dr. Sullivan, let me ask you, we are seeing an increased number of folks seeking out mental health services. What are you seeing specifically with Dominion Behavioral Healthcare?
Yes, clearly this year there's been no shortage of stress, and we're seeing a much greater demand for mental health services, especially treatment for anxiety and depression. Fortunately, mental health treatment is more accessible than ever. Many therapists are working remotely, providing their treatment via telehealth. The telehealth sessions are convenient, and many insurance companies have actually been waiving copays, so even those with some financial hardship can get the treatment that they need. For those not comfortable with the technology required for video sessions, phone sessions are also available. And in addition to our counseling services, psychiatric services are also available, including medication management and some state-of-the-art specialty treatments.
It's incredible to know that you're meeting the needs of these patients in so many ways. As you mentioned, there are the telehealth, there are phone appointments, and a select group of therapists and psychologists, and part of your team are working with in-person appointments as well. Let's talk a little bit, Dr. Patel, about some of the additional services that Dominion Behavioral Healthcare is offering, some of these new innovative therapies and treatments.
Thank you, Jessica. I will be glad to say something about those treatment. We have a team of psychiatrists in our office that evaluate patient and provides their medication management and also diagnostic issues. Most of the time, we have been seeing more patient with depression lately, so they're prescribed some antidepressant medication. Unfortunately, the more antidepressant you prescribe, the less number of the patient respond to that. Because of that, I think we are at the point where we need something else. And we have two other tools in our bag that we can use, and that's TMS and Spravato.
That's incredibly encouraging because, as you said, if you are seeking treatment for depression and are not finding that success, having other tools in the tool belt, as you mentioned, are key. One of those is TMS. Tell us a little bit about that.
Well, first of all, the depression is caused by some dysregulation of neurotransmitter, and there is some part of the brain that's performing or underactive. So when we use medication, they usually correct some of those neurotransmitter. But for the stimulation, we use what is called TMS, or transmagnetic stimulation. It's somewhat similar to MRI kind of concept. And we have, it produces a pulse magnetic field. Through the magnetic field, it stimulates the brain in prefrontal cortex, and that you have to keep on repeatedly every 20 minutes, at least 5 times a week. And we go 4 to 6 weeks. Patient is sitting in the chair watching TV, and after treatment can go back home. And it's a computerized program, so a patient can be treated individually for what they need for their stimulation.
In addition to that TMS, Dr. Patel, you have talked a little bit about a therapy called Spravato, which is specifically for treatment-resistant depression.
Spravato is the newest tool we have, and we were the first one in this area to introduce there. Spravato is a chemical called esketamine, and esketamine comes in nasal spray form rather, and patient comes to our office, they use those nasal spray in their nose, and they sit there for 2 hours, and we do twice a week for 4 weeks, and then once a week, and then continue to taper down. This is a different drug than all other antidepressant in the market at this point, and they continue to work differently than other antidepressants, but they work together. And because of that, their depression gets better and they continue to tolerate it better. However, they do have some side effects like sedation, and sometimes blood pressure goes up, some dissociation. But because of that, we have to monitor them in the office for at least 2 hours. And basically, it's pretty good treatment, tolerative treatment. Our experience has been great with this treatment.
It's so encouraging to know that there are additional therapies and ways to address this, because as we mentioned when we started the conversation, that need for mental health services is certainly increasing. Dr. Sullivan, the best way for someone to find out more about these treatments is to get in touch with the team.
Yes, absolutely. Please reach out, get in touch. There's no better time than right now to take care of yourself. You can reach us at our website, dbhrichmond.com, or give us a call, 804-270-1124.
The biggest step is making that connection. Dr. Sullivan and Dr. Patel, thank you so much for making time. We appreciate it.
Thank you.
Absolutely. We'll share information so that you can connect with Dominion Behavioral Healthcare.
Dominion Behavioral Healthcare is certified for TMS, and Spravato has 2 locations. Their Richmond office is located at 2305 North Parham Road, Suite 3, and their Short Pump location, 2200 Pump Road, Suite 218. For more information, give them a call at 804-270-1124, or you can visit them online at bhrichmond.com. And there's more Virginia This Morning coming up after a quick break.